Welcome to Health Bulletin. Today, we bring you the latest health updates from the world, where multiple disease outbreaks are making headlines. From the Democratic Republic of Congo to the US, these stories highlight the ongoing challenges of public health management. We begin in the Democratic Republic of Congo, where a mysterious febrile illness outbreak is raising alarms. A man recently died showing hemorrhagic fever symptoms, and samples have been sent to Kinshasa for further testing. Africa CDC's Mpox incident management team said officials are considering two possibilities: severe malaria, worsened by malnutrition, and a viral infection. The numbers are worrying, raising new cases and 5 deaths reported in the past week, a total of 592 cases with 62% case fatality rate. Most cases involve children under 10 years old. The situation remains critical as investigators work to determine the scope of the outbreak, including community deaths. Next, let's talk about Mpox. The outbreak in Africa shows no signs of slowing down, with over 3,095 cases reported last week alone. The DRC remains the epicenter, contributing 2,632 cases during this period. In response, Africa CDC and WHO held a continental review with officials from 9 affected countries. Key priorities were identified, right from mobilizing the resources and intensifying support for the hardest-hit nations, also improving data management systems and expanding vaccination efforts, as Mpox continues to spread steadily, requiring urgent attention from governments and health organizations alike. Now, shifting gears a bit, let's talk about chronic wasting disease, CWD, often referred to as zombie deer disease. 2 new cases were confirmed in Montana, affecting a mule deer buck and a male white-tailed deer. CWD is caused by prions, misfolded proteins that are extremely resilient and can persist in the environment for years. While no human cases have been reported, the CDC and WHO advise against consuming meat from infected animals. Hunters are urged to take precautions when handling carcasses, as the disease is spreading through both direct contact and environmental contamination. Turning now to the avian flu, H5N1, the numbers are staggering. According to WHO, over 300 billion birds have died due to the virus, with more than 500 species infected. H5N1 is increasingly breaking species barriers, raising concerns about its potential to affect humans on a larger scale. The CDC has also confirmed the first severe H5N1 case in a US patient, highlighting the growing global threat. Experts warn that the virus could have significant implications for public health if it continues to evolve. But what does this mean? Diseases like H5N1, CWD, Mpox, and the DRC's ongoing outbreaks remind us of the interconnected nature of global health. They also highlight a key challenge: our ability to adapt and respond to new threats, especially as diseases evolve and cross species barriers. Governments and health organizations must prioritize vaccine development and resource allocation. They must strengthen healthcare systems, particularly in underserved regions, and promote community awareness and emphasize more on preventive measures. And these stories remind us of the delicate balance between human, animal, and environmental health. As outbreaks continue to challenge global health systems, staying informed and proactive is more important than ever. We'd love to hear your thoughts on the rising cases of disease outbreaks. If you found this update insightful, don't forget to like, share, and subscribe. Thank you for watching, and as always, stay safe and stay informed.